Hello, welcome to Real Health with me, Carl Henry. Folks, high blood pressure is a silent killer. But when should you start checking? What can we do to avoid it? And what should you do if you find your numbers are high? For all this, I'm delighted to be joined by GP, lecturer, and all-round fabulous person, Dr Sumi Dunne. Welcome to the show. How's it going? Welcome back even to the show. How's it going?
Oh, no, thank you, Carl. Delighted. Always delighted to be back.
This is an important step, right? High blood pressure, I think, is something that people think about. Hear about, but actually don't really know anything about it whatsoever until they go to their GP and their GP tells them about it, and then they kind of forget 5 days later. So we thought we'd do an app just to have a look at it, what it is, what the numbers are, when you should start checking it, and all of that. Kind of an SOS kind of for blood pressure. Let's start in terms of, okay, what is high blood pressure? That's the obvious question to start with.
Yeah, I think the first thing is to say, well, what is blood pressure? So you've got your heart. Your heart is your central pump. And then you've got arteries coming out of the heart that carries oxygenated blood around the body. So as the blood is pumped around the body, you're going to get a pressure, and that's that pressure in that arterial wall. And it's that measurement of that pressure in the arterial wall that is high blood pressure. So you have two types of pressure. You've got a pressure as the blood is literally being squeezed out of the heart, and then you've got a pressure in between each resting beat at the heart. So that as the blood is being pumped out from the heart through these arteries to all the essential organs, that's known as the systolic pressure. So people will see that typically represented as the higher number in a reading of blood pressure. And then as the heart rests in between beats, that's known as the diastolic pressure, and that's the lower number that people will see when they get their blood pressure read.
Okay, so that makes a lot of sense. So the higher number is when the heart's working harder to push it out.
Absolutely.
And then the lower number is when the heart's is at rest.
In between beats.
Yes. Yeah.
So, the heart is always going to be pumping blood through the body. So that's in essence what your blood pressure is. What higher blood pressure is, or high blood pressure is when the pressure is getting higher and higher. So that pumping pressure is getting high and that resting pressure is getting high. So both of those in isolation or two together can cause damage, not only to the heart, but also to the arteries that are pushing out that blood.
Okay, so give me in numbers then. Okay, so what's a normal number and what's low blood pressure and high blood pressure? Okay,
so a nice number that we like, if you're told your blood pressure is 120 over 80, written down as 120 over 80 millimeters of mercury. Millimeters of mercury is that measurement that we use. That's a nice normal blood pressure. That's the numbers we liked for people to have. There will be variations. For example, if you've just rushed into me and said, look, I've been a bit stressed, rushed up the stairs, of course, your blood pressure is going to be a bit higher because there's been some work that's just happened. So if you're going off to get your blood pressure taken, just make sure you're nice and relaxed. You've not been rushing around. You've given yourself 3 or 4 minutes to calm down before your blood pressure is actually being read. And importantly, when your blood pressure is being taken, don't talk. Little things like that can actually elevate the reading. So that's important. We would start saying numbers are going to get high if the blood pressure is creeping over 130 and that 80 is creeping over 90 plus. So then we're saying the blood pressure readings are getting higher. We would say a blood pressure reading is low, typically if we're going to get numbers below 90 over 60. But do remember that people that are super fit and people that exercise regularly, and we've recently had the Olympics, they're going to have low blood pressure because their body works at capacity, but their heart doesn't beat as much because they're used to so much great cardiovascular exercise.
Okay, so blood pressure is linked to resting heart rate then, is it?
It is. Yeah, it is linked to absolutely. Because it's the amount of work that your heart has to do. Now, there are, when we talk about low blood pressure, if you're on medications, if you are, of an older age, if you have any other aspects that are going on, sometimes pregnant women get lower blood pressure. That can make you feel faint. That can make you feel dizzy. And in turn, you don't want anyone to fall. So if that is happening and your blood pressure is low, that needs to be looked into. But we tend to get more concerned in a community around high blood pressure because most people don't know that they've got high blood pressure. You can walk around and not realize that you've got any symptoms whatsoever.
Okay. And what age do we start checking it then? So what age should it be in our 20s, in our 30s, or,
Yeah, it's a really interesting one. At the moment, really, really interestingly, as I've just spoken about medications, we routinely check blood pressure in quite young people. If you're on the pill and you've been started on the pill and you're on a particular type of pill called combined oral contraceptive, you will get your blood pressure checked twice a year, because we know there's an association with being on the pill and potential high blood pressure. So, if you think about it, that's a really, really young age group, but yet it's really important because of the medications prescribed. If somebody is not on the combined oral contraceptive, it's really worth getting your blood pressure probably checked in your 30s to begin with.
And should it be a number? I suppose. As you know, I'm all about knowing numbers.
Yeah.
We should know it. It's just one of those things you should know as part of kind of a general health checkup.
Absolutely. I think everybody should be carrying 120/80 in their head.
Yeah. Okay.
I think that's a nice number to be carrying. If you are, you consider yourself fit, you do a moderate amount of exercise and you are eating well, that's a nice number. Absolutely. People are individuals. There'll be different aspects that come into play, different life events at different times. Numbers might change, but that's really important to hold, 120/80.
Okay, and then where and how do you get it checked? So do you have to go to your GP to get it done? Can you get it done in your pharmacy? Can you do it at home?
Oh, yeah, lots of really good places to get your blood pressure checked. Absolutely. As GPs, we're really happy to check your blood pressure. Quite often, if you come into us, we will opportunistically check your blood pressure. If not, our nurse-led clinics can also check your blood pressure. Your pharmacist can check your blood pressure. There are now an abundance of great home monitoring blood pressure measurements because it's virtually now a electronic cuff. Very few of us have gone back to using the old, do you remember the manual sphygmomanometer?
Oh, yeah.
Pump up a cuff. We've moved away from that. We still do use it. It's got a valuable clinical aspect, but more and more nowadays we're using electronic cuffs. So it's quite easy to get your blood pressure measured. If you're young and you're fit and you're healthy and you're in your 30s, a really interesting fact, if your blood pressure is normal and you lead a normal, healthy lifestyle, you actually don't need to get it checked any sooner than every 5 years. Would you believe it or not?
Wow.
Yeah.
And is healthy blood pressure linked then to lifestyle factors and lifestyle modifications, i.e. like weight, diet, stress levels, activity levels?
Absolutely. And what we do know, there is so much that people can do to look after their own blood pressure. Eating well, can't say that enough. Reducing the amount of salt in your diet, be really quite critical around that. We really don't need to be adding salt to our diet. If you have to, no more than 1 level teaspoon per day to keep it less than 6 grams per day.
That's a lot of salt. I take no salt on board whatsoever, but that's like 1 level teaspoon is like, it's a fair bit of salt in that.
There is a fair bit of salt in that, but that's if you absolutely have to, and sometimes palates do adapt. The less salt you put on your diet, the less salt you actually need. And you get used to eating no salt, over a process of time. Being physically more active, trying to get, that good cardiovascular work in every day, a good 30 minutes that leaves you nice and sweaty every day.
And that's important, isn't it? It's the fact that the exercise has to be a bit more moderate than just kind of going for a stroll and having a chat.
Yeah. If you're talking and texting and walking, that's not fast enough. No. You need to be that slightly sweaty, feeling the heart pumping at the end of the exercise. And that exercise form can take whatever, fashion that you fancy.
Yeah, it's slightly uncomfortable.
Totally. Doesn't have to be running. It can be a really nice, good, fast walk. It can be cycling. It can be swimming. It can be, doing an exercise class with friends, whatever. You just need to be slightly sweaty and feel that heart rate and kind of going, I'm just a little bit out of breath at the end of that.
And what does high blood pressure then? So say someone comes into you and they have you measured, it's high. What happens if it's left untreated? So where does that go to? Where does it develop?
Absolutely. So let's go back to those first principles I spoke about, heart pump, and it's being pushed out at force from the heart through the arteries to the organs. What's going to happen if that pressure goes up, like any pump system? The actual vessels, those artery walls are going to get weakened if there's a higher pressure being pushed through it on a regular basis. So those artery walls are going to get thinner over a course of time. And then what can happen is that as the walls get thinner, they get weakened. And if they get weakened, they're at potential for a hemorrhage. And if those blood vessels happen to be the blood vessels leading up into the brain, that hemorrhage could therefore be a stroke. Similarly, as the arteries get weakened and they then, let's say, balloon out, you can get depositions of plaque coming from cholesterol aspects that can go and sit in those weakened, wall linings. And plaque can then, build up. And then all of a sudden, with high pressure behind it, that piece of plaque can fly off. And that can block a major vessel, possibly going to the heart or again the brain, and that can lead to chest pain. At worst, it can lead to a myocardial infarction known as a heart attack, or again it can cause a clot, and that may go off and again cause a stroke. So there is lots of important things here that we need to be aware of.
So as you're chatting through that, I'm picturing a river bursting its banks, kind of, in terms of, the artery and it getting weakened, and then all of a sudden it bursts.
That's, it's possibly a little bit reductionist, but...
absolutely.
It probably is a little bit reductionist on that one, but... I'm
overly simplifying the concept, but just trying for people listening in who sometimes can get maybe getting lost...
Totally.
So it's an analogy to look, things the artery, the wall weakens, and then
that's wall weakens, and you've got a continual flow of something high pressure behind it. And if you're going to get continual flow of high pressure down, a smaller artery, the artery wall will only give to a certain point, and after that, damage plus then a event is going to happen. And that's why, people will hear that if your blood pressure runs high, you could get a heart attack or you could get a stroke. But there are other aspects, other organs can get targeted. People might even find that there could be kidney damage if their blood pressure is left unregulated. There could be heart failure. There may even be erectile dysfunction or sexual dysfunction. We may even see visual loss as well. So it's not just the heart and the brain. Other organs can get affected if the blood pressure is running particularly high.
Okay, so it's really important. And so really someone comes into you, they've got high blood pressure, then what do you do? So obviously there's a medical aspect to that, and then there's a lifestyle recommendation on that too.
Absolutely. So, normal blood pressure, as I've said, is 120/80. Raised blood pressure is 130/80, and high blood pressure is 140/90. So you can see kind of the trend in the numbers there. If somebody is with me and their first blood pressure reading is high, and it's the first time I've picked it up, I will try and get a second reading at least 20 minutes apart. And that's really important for somebody that's measuring their blood pressure at home. If your first reading is high, don't immediately repeat it. There is what we call a nervous response that will make the next reading equally high, if not higher. So leave it alone, walk away, come back at least a minimum of 20 minutes later, if not later on in the day, if not the day after, and then repeat it again. We need 3 separate readings, at least 20 minutes apart, of each reading to be high to say, okay, that's a high blood pressure reading. If that's what's happening in the home environment, or it's been picked up in the general practice, or it's been picked up in the pharmacy, we do what we call a gold standard, known as a 24-hour blood pressure reading monitor, which is a mini blood pressure machine attached to your waist. The cuff is wrapped around your arm, and you wear it for an entire day and through the night. And yes, it does inflate through the night at regular intervals, but it's only for 24 hours. And that gives us a great overall reading of an average daytime reading, an average nighttime reading, and then a total average over 24 hours. And if we pick the blood pressure up to be high over that 24 hours, that pretty much is your diagnosis of hypertension, high blood pressure.
And from there, then, what you tell people to change their lifestyle habits?
Dual-pronged approach. Yep. It will be changing lifestyle in adjunct to commencing medication.
Yep.
So it's dual-pronged at that point. Once the diagnosis has come, then we do strive to do both by changing lifestyle, by looking at salt, by exercising, stopping smoking, increasing physical activity, stress reduction, mindfulness, all of that. you can do that work yourself. And studies have shown that you can actually reduce your own blood pressure reading by as much as 10 millimeters of mercury by doing that work yourself. So that's really important.
And what do the medicines actually do then? Do they thin the blood out, or what do they do?
There are different categories. There's 4 main broad categories. One is known as an ACE inhibitor that works through the kidney. Another one is known as a diuretic, again, that works through the kidney to reduce, the overall fluid load in the body. There's another one known as a beta blocker that reduces the pumping rate of the heart, so the heart doesn't work as hard. And then there's another drug known as calcium channel blockers, which again acts through the blood vessel system in order to improve blood flow, reducing the pressure. So it can be a combination of drugs. We tend to start with one drug, and that's based, interestingly, on the patient profile. So it's very much tailored to the patient profile. Someone of a certain age, certain ethnicity will be started on one group of drugs. Somebody else of a different ethnicity, a different age might be started on another group of drugs. Sometimes we have to add in 2 together. Rarely, we might have to add in 3. And very, very rarely, we might have to add in 4. And in that instance, if we're looking at 4 or more, we tend to have them tied in with cardiology at that point. But all of them, irrespective of whether you start on medications or not, you can't do any harm by, looking at lifestyle, getting moving, reducing salt, stopping smoking, mindfulness, eating well. Do you see the common theme here?
Absolutely. Those lifestyle factors are so important. How common is it then in Ireland? So we've looked at the different aspects of it and what you do if you have it. How common is it?
It's more common than you think. Okay. And really interestingly, over the last 30, 40 years, given that our diet has changed and there has become an easier access to processed food, ultra-processed food, heavily salted food, packet food, this has all had a massive impact on diseases that we may not have seen so much of, the chronic diseases, type 2 diabetes or hypertension back, 40, 50 years ago. So again, we just need to be aware that environment can also play a huge role in the development of this. So we need to be cognizant of all of this. And again, one size doesn't fit all. No one is to blame, but it's important to be aware of numbers.
Dr. Sumi Dunne, thank you so much for joining us. I think that's really important. It's great education. It's tools. It's so helpful for people in terms of understanding what blood pressure actually is. And we really appreciate you taking the time out to join us today. Thank you so much. Folks, I really hope you enjoyed today's episode of Real Health with me, Carl Henry. As ever, you know where we are at Carl Henry PT on Instagram, realhealth.independent.ie and on the Irish Independent website. We'll see you next week for more Real Health. Slán go bhfuil.